Assalamualaikum warahmatullahi wabarakatuh. Hello everyone, how are you today? I hope you all in a good condition. My name is Eric as a moderator, and the members of Team 7 are Abdalia, Cindy, and Titin. Today we are going to talk about cardiovascular. First material will be explained by me. Definition: Cardiovascular consists of two syllables, namely cardiac and vascular. Cardiac means heart and vascular means blood vessels. Location: the location of the heart is in the mediastinum cavity, in the middle of the thoracic cavity. Between the two lungs, the lower limit of the diaphragma is precisely in the intercostal 5 and 6 left lining. The heart has three layers: pericardium, endocardium, and myocardium, and four chambers, two atrium and two ventricles, four valves: mitral, aortic, tricuspid, and pulmonary. Cardiovascular system consists of heart as a pumps blood throughout the body, blood vessels as a connecting pipe between the heart and cells, blood as a transporting substance, oxygen, nutrients, CO2, hormones, enzymes, and rest of the metabolism.
Cardiovascular disease part 1. First, heart attack. Heart attack occurs when blood flow to the heart is blocked by blood clots. Blood clots can cause the heart muscle to die because it does not get enough blood supply. Second, atherosclerosis. Atherosclerosis is inflammation of the blood vessels that occurs when plaque forms along the walls of blood vessels. Third, arrhythmia. Arrhythmia is a condition of the heart has an abnormal rhythm or rhythm. The heart can beat too slowly, too fast, or irregularly. Cardiovascular disease part 2. Fourth, coronary heart disease. Coronary heart disease occurs due to blockage or narrowing in the blood vessels of the coronary arteries due to plaque buildup. The biggest cause of coronary heart disease is the habit of smoking. Fifth, stroke. Stroke occurs when the blood vessels that supply blood to the brain has a blockage. Sixth, heart valve disease. Heart valve disease is a disease that occurs due to the existence of a problem or a disorder in one or more of the four valves of the heart. 7. Deep vein thrombosis or DVT. Deep vein thrombosis or DVT is due to the formation of a blood clot in a vein, usually in the legs. Cardiovascular disease part 3. 8. Heart failure. Heart failure occurs when the heart is unable to contract and relax normally, failing to pump blood throughout the body as it should. Ninth, congenital heart disease. Congenital heart disease is a disease that occurs due to abnormalities in the structure of the heart since in the womb. 10. Peripheral artery disease. Peripheral artery disease is a condition in which blood flow to the legs is blocked due to the narrowing of the arteries. 11. Peripheral venous disease. Peripheral venous disease occurs when there is damage to the veins that serve to transport blood from the legs and arms to return to the heart.
Causes of cardiovascular disease. Causes of heart disease are damage, blockage, inflammation, and abnormality in the head. McLeod and blood vessels around it blocked in the head vessels are usually caused by plaque. This plaque builds up and damage artery. Over time, plaque can harden and then break. Other causes are imperfect head development, infection, or oxygen-rich blood flow to the head that is not supplied properly. Cardiovascular disease risk factor: age, smoking, alcohol, dietary pattern, physical activity, obesity, hypertension.
Solution. The first is that tests to diagnose heart disease can include 1. Electrocardiogram. 2. Holter monitoring. 3. Echocardiogram. 4. Cardiac catheterization. 5. Computerized tomography scan of the heart. 6. Magnetic resonance imaging of the heart. In general, treatment for heart disease usually include lifestyle change. 1. Stop smoking and stay away from cigarettes smoked around. 2. Control other heart conditions such as high blood pressure, high cholesterol, and diabetes. 3. Exercise at least 30 minutes most days of the week. Consume foods that are healthy, such as low salt and saturated fat. Consumption medication from the doctor. Heart disease medication are of various types. For example, heparin medication used to prevent complications after a heart attack. High blood pressure medication such as ACE inhibition, diuretics, angiotensin II, receptor blockers, beta blockers, aldosterone, and inotropics. Aspirin and statins are medications to lower cholesterol. Medical procedure or surgeries. For example, angioplasty, which is the process of introducing a stent or a ring of the heart skin of small, flexible tube that is inserted into the arteries to encourage blood flow. It can also be coronary artery bypass surgery, which is surgery that is done by moving blood vessels in one area to another to increase blood flow to the heart.
Well, that's all we have. I hope the presentation will give benefit for us. Thank you for your attention. Wassalamualaikum warahmatullahi wabarakatuh.